I'm a dork.
All right, so coming in for your skills. Are you guys ready? Okay, you've already knocked on the door, introduced yourself, identified your patient, bringing your bed up to your work level, and let them know what you're going to be doing. So to start off with your evaluations or even your practice, we're going to come in, and I've already talked to my patient, let them know everything that I'm doing. I've already checked allergies, and I'm ready to get started. So I'm going to flush the PLOC for the MD order. So they're going to give you an order of how much to do this. Usually most hospitals have a 10 cc syringe, but you may not always use the 10 cc syringe. So you need to go in and clean your PLOC. First thing that we do, because we need to assess our IV before we put medicine into it. So 1, 2, 3, 60. Once I'm done with that, I'm gonna open up my saline flush. Usually you have to pull it back to get the air out. Bring the fluid to the top, see where it's at. Mine is sitting at 7.5. And the first thing you're going to do is put it onto your Luer lock, unlock or unclamp the patient. Talking to them, so I'm pushing the saline fluid, they know that. Checking your IV site, I don't see anything, don't see any coolness, swelling, I'm not feeling anything. The patient said it hasn't been hurting him. So I'm going to go ahead and just flush 2 milliliters of fluid. Looking for any swelling, coolness, seeing if the patient says there's any discomfort. There's no discomfort. I've pushed my 2.5. I'm gonna pull back just so I can see if there's blood return in the hub. Now, of course, this patient doesn't have blood, so they're not really going to have a blood return, but I'm only looking for blood return right here at the top of the IV site. Once I see that there's blood return, or if elderly people, small vessels, you may not get blood return, but there's no pain, no swelling, it looks good, and it's flushing easy. I'm gonna push that 1 milliliter that I have left, because say my order was for 3. And when I'm done, I'm going to clamp the IV site and then remove my saline flush. So now I've done the assessment of my IV site, and I know everything's working well, feels okay, and I'm going to move on to the next. So that part is done. You come in, looked at your orders, and you know that the doctor wants you to run your primary fluid at a certain rate, and say we run out of pumps, because we said, you know, that's happened lately, and that you have to do a drip factor. So in order to do your drip factor, it's sticking to me, you're going to get your primary bag with your primary tubing, which does not have the blue hook, ready. Remember, these just open Velcro on the side. When you first open your tubing bag, the very first thing you do, get all your paper gone, clamp your tubing, and then own your tubing, right? So you're gonna get this out, get it unraveled, and I'm gonna keep track of it. This port is where you mix meds. It's the one farther away that you'd spike your bag. Remember, this is sterile, so you're owning it. Grab your tubing, grab your spike, and get ready. If I didn't clamp it, I'd be taking a bath right now. You're gonna fill your chamber to where you see these little lines are on your chamber. And then you will ever so slowly prime your tubing, because we're never going to give a patient air. And you can go as slow as you want, because over time you're going to get faster and faster, so don't worry about this. Go nice and slow, you start to see it flowing. Get it through your IV. Didn't even take that long, did it? And now what I'm going to be assessing for is the drip chamber. So I want to make sure that I get the proper amount of drips before I hook it up to my patient. So when you guys come in, you're going to own your tubing. They might have you hook it right up to the patient or just place it in the can, because we're really just focused on, can you get the right number, okay? And you're not gonna hook up to your patient until you know. We're not gonna be like, oh look, I almost bolused the patient. So get your stuff set first. So if I wanna get 8 drops in 15 seconds, because maybe I'm supposed to get 32 drops per minute, I'm gonna say, okay, 32 divided by 4 is 8. I want 8 drops in 15 seconds, and then I'm gonna let this go, and I'll do my 8 drops in 15 seconds. Slow is good. You want to get yourself a nice little number, do 1 or 2 tries. I'm going to stick with about here, you'd have your watch with the sweep hand, no fancy watches. And 1, 2, 3, 4, 5, 6, 7, 8, and that's a little too soon when I look at the clock there. So I'm going to slow it down just a little. And I'll start now. 1, 2, 3, 4, 5, 6, 7, 8, and 15 seconds exactly. So now I would want to take this and count for 1 full minute. Make sure that I get 32 drops in the 1 full minute, and then I would let my instructor know that I'm ready for them to come check me. They checked your drops, you're golden, because you'll do great. Now I will completely clamp this off. We already assessed our IV. We know what's good for our patient, but I'm just gonna get ready now to set up my primary. I have my clamps clamped. This is also clamped. 1, 2, 3, 60. If I question if this was clean or not, 1, 2, 3, 60. And connect your patient. Now, you want to bring your lock up close to this first Y port, because if you have it down low, your patient only has this much room to move. You want to give your patient room. So not all the way up to this Y, but pretty close to it, making sure that your patient has enough flexibility to move their arm across their bed if they wanted. So now I'm gonna get ready to set up my pump. I'm gonna put my key in, everything's still clamped. Bring my tubing down. You pull this taut and push in your tubing until your pump says it's all green. I close with both thumbs because it's easier. And now I'm gonna go to general care. So I'm gonna get my lock out, that's always my routine. Go into general care or med surg. My first primary is normal saline. I've already checked this against my MAR. I know the patient can have it, and the doctor wants me to set it at 125. Let's say I figured out my math problem and that's what I got. So I'm gonna set this for just regular IV fluid. Remember, the pumps might want IV fluid plain, IV fluid, or maintenance fluid. That's what any of your primary bags go under. I don't have any additive, I don't need to worry about that. Doctor wants it at 125. 1, 2, 5 is my rate for milliliters per hour. And remember, to confirm it, you don't hit down, you hit okay. This is a brand new bag. There's 1,000 milliliters in here. You never let your primary run dry. I'm gonna set that for 950, okay. The volume given, this is what you're going to check as a nurse. So if I come in an hour and I have this set for 125 an hour, when I hit review program, it should say that 125 has been infused in my patient. We don't set that for anything. Our line is now ready to go, because when you get to your bottom screen, you're either saying run or just checking things out. So I'm gonna say, okay, that's what I want, 125, 950. I'm all set, I'm gonna hit run. Is there drops falling? Nope, because I know that I didn't unclamp my tubing down here or at my patient. So you have 1 clamp, 2 clamps, 3 clamps. Anything below the pump, downstream occlusion. Anything above the pump, upstream occlusion. Now I have my drops, everything's open. Yes, there's drops dropping. I'm good to go. You'd have your instructor come check. Time to set up the secondary. Okay, I'm gonna hit stop, and I'm going to hit review program, program secondary. Now I have to get my secondary read. Already checked my allergies, already checked against the MAR. Let's say this is the MAR, I'm still checking, everything's good to go. I have my stuff at my bedside with me, because if you were in clinical, you would have your chart, your computer right with you. Again, these open like that. I know this needs to go by gravity. I need to get my primary lower than my secondary. I put the hook through for mine. And I like to make sure it's secure by putting this here and then putting that up around there. There's my lower. Still got this tubing in my hand. Take off all the wrappers, clamp your tubing, own your tubing. Take off your ends, you can either prime your chamber and flow it all the way down through. If you do that, just go nice and slow, because remember, antibiotics are good till the last drop. So I'm going to prime this all the way down, or you could back flush. I'm going to get rid of that. This was just sitting there, so I want to clean this before I connect them. 1, 2, 3, 60. And that's now hooked up. This is clamped, nothing's running. What do I have? If there will be a label saying what you have. So I think you guys practice with Levaquin. So we'll go with Levaquin. 1, 2, 3, old-fashioned texting. I'm looking for Levaquin or the levofloxacin. Scroll down to that. Okay. What's my secondary that I have? Is it 700 milligrams in a 150 or 500 in a 100? That means there's 500 milligrams of Levaquin in this 100 milliliter, which is right up here, bag of solution. So yes, that's what I have, a 500 and a 100. Are you sure that's what you have? Yes. Remember, don't go quickly past your prompts or you can have an error. Are you using a primary and a secondary setup, or just primary? Primary, secondary. I'm good. Yes, that's what I'm using. You'll look at your orders to figure out. So the doctor may not say they want 100 mils an hour. They may say, I want this run over an hour. Well, now you have to say, well, if there's 100 milliliters in this bag and the doctor wants it over an hour, I'm going to run it at 100. What happens if you wanted it to run over 2 hours? What do you set your pump at?
50.
50. If he wants it run in 30 minutes, what do you set your pump at?
200.
Good. So you're just looking at your volume. So he wants it run over an hour, so I'm going to do 100 volume to be infused, which is what's here, 100. And now I'm at the bottom of my screen, so this is where I'm taking action, right? So I'm going to say, yep, that's what I want. Do you want called back at the end of your secondary? Absolutely. I would like to know that I did not mess up and the antibiotic went in. My routine is before you start, you unclamp, but if you didn't, are there drops dropping? No. So I look down here, dang. So the only reason that would be happening is if I didn't unclamp this one. So now our drops dropping in the secondary. Give it a minute. I see it there, not here. I'm good to go. I've just set up my secondary. At the end, the antibiotic ran and the doctor said, okay, we look like we're good hydration wise. After this bag, let's discontinue the IV. We don't need any more antibiotics. Patient is showing improvement. So let's say this has finished. Your instructor has checked your secondary. You're just gonna stop. You can shut off your pump, because if the pump's not moving, nothing's moving into your patient. But I'm gonna clamp this anyway. If it was just normal saline running through, I can just discontinue this, no problem. But if it was just the antibiotic that went through, that means there's antibiotics sitting right here. I would want to get rid of that, so I'd have a new flush. If you want to, you can just take it off like this, take this off, and put it in. Or if when in doubt, if you feel like, I think I need to wipe that, just do it. You can just wipe it. I only have an order to flush with 3. 1, 2, 3 milliliters. Now I'm going to clamp this. My line is flushed out, so if I start another med, I'm not mixing chemicals here. I just cleaned it with saline, so it's good to go. Antimicrobial end on this, or the end to your flushes, if you've kept that nice and clean, can go on. They actually fit perfect. Hang up your tubing. And your patient has now discontinued their IV. It's just at a P-lock. That's all IV.